Okay, so we're talking chapter 10, which is all about the patient appearance, which is ASA classifications. So, ASA class 1, that's going to be your normal healthy patient. We remember this based on the body. So remember, on your feet is a normal healthy patient. People that are ASA 1 are going to be non-smokers, no drinkers, and they can have routine dental treatment. You have to recheck their blood pressure every 6 months, and then you can implement stress reduction if they're nervous, but really they don't have anxiety. So, perfect patient basically. Non-smoker, non-drinker, routine dental treatment, recheck blood pressure every 6 months. Okay, then you move up the body and you go to the shins, and on the shins is ASA 2. So I want you to picture the words mild systemic disease on your shins. So these patients, they're going to have mild systemic or well-controlled diseases. So, for example, if they have allergies, they're going to be ASA 2. Pregnancy, if they're above age 60. If they have anxiety, they're automatically ASA 2. If they have high blood pressure, they're going to fall between 140 and 159 systolic and 90 to 94 diastolic. Again, ASA 2 is 140 to 159 systolic. Okay, then you have asthma and short-term upper respiratory infection, or in other words, a cold. So, nothing to do with like big diseases, just mostly stuff we can control. Diabetes, they're going to be type 2, which is non-insulin dependent. Hyperthyroid or hypothyroid disorders that are obviously controlled. And they can be a drinker if they're in ASA 2. For these people, we want to recheck their blood pressure during 3 consecutive appointments. We want to make sure they're monitoring their blood pressure at home. We want to be extra careful after giving anesthesia to make sure we know their blood pressure. So again, that's ASA 2. So remember, on our feet, normal healthy patient. On the shins, mild systemic healthy patient. Okay, then you have ASA 3. This is going to be on your thighs, and it's severe systemic disease or uncontrolled. So remember, number 1, healthy. Number 2, mild systemic disease controlled. Number 3, severe systemic diseases that are not controlled. These are going to be people that can have some sort of activity but are totally incapacitated. So they have a history of heart disease, myocardial infarction, transient ischemic attack for more than 6 months before dental appointments, congestive heart failure, angina pectoris, which is stable though. Remember, ASA 3 is stable angina. High blood pressure is going to be 160 to 199. They can have emphysema, chronic obstructive pulmonary disease, and asthma, which is exercise-induced. Epilepsy, that's less controlled. Diabetes type 1, hyperthyroid and hypothyroidism, and these are going to be smokers. With one and then more than a minimal drinker, so drinking more often. For these people, we want to recheck blood pressure in 5 minutes, because remember, it's a lot higher. We want to have a med consult if blood pressure is elevated, and we want to make sure we're inducing stress reduction protocols, because these patients have a higher risk of having more medical emergencies due to stress. So again, that's ASA 3, severe systemic disease that is not controlled. Okay, then you start getting up, and I want you to picture your butt. So ASA 4 is severe systemic disease that is not controlled and a constant threat to life. So I want you to picture like a person who is stuck sitting in a chair and they can't get up. Their body's a constant threat to life. They can't get up and move forward and walk out of the chair. These people, you're going to have a heart attack less than 6 months, brain attack past 6 months, severe heart failure or COPD that requires oxygen supplementation, unstable angina, high blood pressure greater than 200, severe COPD, epilepsy that's uncontrolled, diabetes type 1 that's uncontrolled or they've been hospitalized for it. For these people, we recheck every 5 minutes their blood pressure. Med consult before dental treatment if blood pressure is still elevated, And we definitely want to make sure we really reduce stress, because these people are even at a higher chance of having a medical emergency. ASA 4 is the most common that we're going to see in the dental office, but we really shouldn't even be treating them. Okay, ASA 5. Remember, we had our feet, our shins, our thighs, and our butt, and now we're moving up to our chest. On our chest and shoulder area, we're going to have a moribund patient who's not expected to survive without an operation due to terminal diseases or conditions. These people are most likely on their way to dying, and we won't ever treat them. And it's obvious that we do not deliver dental treatment until their blood pressure is corrected. And then ASA 6 is the last one, and those are clinically dead patients that are having the organs taken out. So, quick review on that. ASA 1, healthy patient, non-smoker, non-drinker, good for dental treatment. Don't need to check their blood pressure every time. ASA 2 is on the shins, mild systemic disease that's controlled. Those people are going to be people that have pregnancy, asthma, older than 6 years old, minimal drinker, and a smoker. ASA 3 is going to be on your thighs, severe systemic disease that it's uncontrolled. Remember, uncontrolled written on your thighs, so you can remember that. These are going to be all the heart issues, unstable angina, emphysema, chronic obstructive pulmonary disease, asthma, exercise-induced, diabetes type 1, smoker, and heavy drinker. We recheck their blood pressure every 5 minutes, med consult if blood pressure is not controlled. Okay, ASA 4 is on your butt, remember, and this is patients who their condition is a constant threat to life. So remember, your butt, if it has a condition, it's a constant threat to your life. You can't move around if you can't use your butt. These are people that have had a heart attack in less than 6 months, brain issues, stroke in less than 6 months, severe heart failure, COPD that requires oxygen, angina that's unstable, high blood pressure, greater than 200 millimeters. And then ASA 5 is your chest. These are moribund patients that are not expected to live very long. And then ASA 6 is patients that are dead that are getting their organs harvested. Alright, let's keep going. Okay, this is important to remember. These are modifications for local anesthesia. So, if your patient has diabetes, we need to remember epinephrine opposes the action of insulin. So, if your patient has diabetes and they're taking insulin, if we give them epinephrine or anesthetic that has epinephrine, it's going to mess up their medicine. Typically, only small amounts are used in dentistry and don't really raise the blood levels. But to modify, we use epinephrine with caution. Okay, glaucoma. If your patient has glaucoma, we need to remember vasoconstrictors cause increased ocular pressure, which is pressure in the eyes. So, if they have glaucoma, we need to just avoid vasoconstrictors altogether. We don't want that pressure in their eye. Okay, if your patient has hypertension, we need to remember vasoconstrictors can increase the risk of hypertensive episodes. However, the lack of anesthesia can also increase the risk, so this is very controversial. Do you give them anesthetic or do you not? Clinical judgment and medical consult is advised in this situation. Uncontrolled hypertensives either should not be treated or treated with caution, basically, is what we're going to go with. Okay, if your patient has hyperthyroidism and it's controlled, we know that hyperthyroidism increases tissue sensitivity to epinephrine. So when there's obvious evidence of hyperthyroidism, we want to avoid epinephrine altogether. Remember, hyperthyroidism is an absolute contraindication to epinephrine. Same thing if they have hyperthyroidism that's uncontrolled. They have a higher risk of increased tissue sensitivity, and we want to avoid epinephrine. Okay, hypothyroidism is safe. Hypothyroid patients tend to be sensitive to CNA depressants. Local anesthetic doses should be kept to a minimum, but doesn't mean you have to absolutely forgo them. Okay, now we have hypothyroidism that's poorly controlled. In this situation, you want to be more cautious with the local anesthetic dosing because hypothermia, bradycardia, severe hypotension is possible. And if they have severe hypothyroidism, we want to avoid everything altogether. Okay, let's keep going. Okay, now these are just conditions that may affect our dentistry work. So, if our patient has severe hepatic disease or liver disease, we need to remember, amides are primarily metabolized in the liver. Amide has an I in it, liver has an I in it. Anything with an I in it, besides articaine, is metabolized in the liver. So, if they have liver disease, we need to be careful not to give them an anesthetic that is an amide because they won't be able to metabolize it. We want to go with articaine because articaine is not really metabolized in the liver, it's metabolized in the blood. And we also want to have shorter appointments. Okay, if they have something called atypical cholinesterase, that is a condition where they cannot break down esters. Cholinesterase is a protein that breaks down esters in metabolism. So, if you're using an amide anesthetic, nothing is affected because that's not the issue. The issue is esters. So we want to avoid esters and avoid articaine. If they have renal dysfunction or kidney dysfunction, all drugs cleared more slowly with risk of overdose if they have kidney dysfunction. So remember, the kidneys help clear everything from our body. So now these drugs are going to be cleared more slowly and they have a higher risk of overdose because your body isn't clearing it in time. So we want to have a medical consult and limit doses of all drugs. Okay, if they have methemoglobinemia, we need to remember, methemoglobinemia means they cannot produce the oxygen carrying capacity in their blood. This disease or condition is increased with the use of prilocaine and benzocaine for some reason. Prilocaine and benzocaine cause this issue to happen more often. So we want to substitute for other amides and other topicals. We don't want to use prilocaine and not benzocaine. And then malignant hyperthermia. We need to remember local anesthetic agents are safe for malignant hyperthermia. But you always want to have a med consult. Okay, let's keep going, almost done. Modifications for local anesthesia. So these are drug issues, okay? So anticonvulsants, which is stuff for seizures. This is going to be Klonopin, Dilantin, Dipocate, Topamax. These reduce anxiety, and you need to have reduced anxiety to have local anesthesia effective. But these drugs are sensitive to CNS depressants, so we need to avoid higher doses of local anesthesia. Okay, antipsychotics, which is for anxiety. This is Zyprexa, Seroquel, Risperdal. These are also increased sensitivity to CNS depressants, so we want to avoid higher doses as well. Antidepressants, these don't have an issue with anesthetic, but they have an issue with epinephrine. You have an increased risk of hypertensive episode by opposing the reuptake of norepinephrine. We want to limit the doses of epinephrine and observe the cardiac dose limits. And we also want to avoid the other vasoconstrictor, which is levonorepinephrine, for tricyclic antidepressants. Okay. And then regular antidepressants, which is serotonin and norepinephrine, reuptake inhibitor. These are going to be Effexor and Savella. These oppose the reuptake of norepinephrine, so we want to use caution. Let's see. Okay, another important one, beta blockers, non-selective. This is for high blood pressure. Propranolol, minimal doses of lidocaine are recommended. With these, there's an increased risk of hypertensive episode. So, unless you have to have a vasoconstrictor, we want to limit or avoid it altogether. Remember, that's non-selective beta blocker.